All right, so we just did your MPI. I'll set you up now. Perfect. All right, so on the MPI, you can have a score from 0 to 108. I'll show you what yours looked like. All the pink is plaque. So your score was an 85, which is a little on the higher end. The plaque was sitting a little bit more in between your teeth, if you can kind of see in there, as well as along the gum lines, so where your tooth and gums meet. Those are where plaque really likes to sit. Do you have any questions about that so far? All right. So I want to go over the pocket depths that we took earlier as well. That's going to, your pocket depths were a little bit on the deeper side as well. So this picture can kind of show how that looks. They were between 3s and 4s, a lot of 4s, a few 5s. So that's a little bit on the higher end of things, the more severe side. So 1s, 2s, and 3s are considered healthy. Since you had some 4s, that's a little bit more inflammation. So your gums are just a little bit more irritated. There's a lot more plaque under there. So we just need to do a little bit better job getting under there. So you can kind of see from these pictures. Does that kind of make sense? Mm-hmm. Okay. And then
how do I prevent it?
So good question. With your oral hygiene, which is kind of what we're doing right now. So I'll show you a little trick on brushing wise, how to get a little bit better brushing. Okay, so what you want to do is focus at a 45-degree angle. You're going to brush up towards the gum line here in a nice little circular motion. And then going down towards the gum line on the bottom teeth. You also want to make sure you're getting on the insides of your teeth as well. Does that seem doable to you?
Mm-hmm.
I know you don't necessarily like brushing, but the brushing twice a day is what's really going to help prevent the buildup of that plaque. Because plaque can build up within seconds, and then if you don't get that removed, that is what turns into the calculus, and that's what gets underneath your gums, and that's what causes problems along the way, like bone loss. So if we don't take care of it right away, that's what's going to help, or that's what's going to cause tooth loss, right? Mm-hmm. All right, and I just want to show you some flossing as well. All right, so when you take the floss, you want to wrap it around your middle fingers, and then use your 2 pointer fingers to go in between the teeth and wrap it in a C formation like that.
Every time I do that, I start bleeding.
So that's a sign of infection. Bleeding actually isn't normal. So anytime you're bleeding, that's a sign of infection, which means you actually need to brush and floss more to help get rid of it. So the more you floss and the more you brush, that's going to help minimize the bleeding. Does that make sense?
Mm-hmm.
All right. And then one last thing I wanted to touch base on. We talked earlier about you having a little bit more of a higher carb diet. So with that, if you can focus on more of the complex carbs, so like white bread, wheat bread, maybe like quinoa or something, that's a nice substitute versus like the sticky carbs that have a little bit more sugar, because that sugar is what's really going to sit on your teeth and potentially cause cavities. So this picture kind of explains that, how when the sugar sitting on there, the bacteria interacts with that, and then that eats away at your tooth structure. So we don't want that to be a problem down the road either. Does that make sense?
Mm-hmm. Okay. So, fluoride, is that technically good or bad for your teeth?
So fluoride is excellent. It's kind of think of it as making your teeth stronger. So it kind of puts like a covering on it, and it just helps to remineralize, make it harder. So if you do have any like weak spots or potential areas that are a little bit softer because of starting to get decayed, that'll kind of just help slow it down and give it a little bit more of a boost, if that makes sense.
Mm-hmm.
Okay. All right, so lastly, I just want you to demonstrate in your mouth the brushing techniques that we talked about. So I'll hand you this. And that is yours to take home. Can you show me kind of what I was demonstrating earlier? You can, yeah, look in the mouth. Yeah. And you want to do a little bit softer. There you go, that's perfect. Now how does it look on the bottom?
Huh?
So when you're doing it on the bottom, how should, yep, angling it downwards, that's perfect.
So how often should I change my toothbrush then? Because my bristles get like worn out easy.
So if your bristles are getting worn out, that's a sign of you brushing too hard. That can cause recession. That can cause the gums to get pulled away from the tooth. I can take that back. Yeah, that can help cause recession. So if that's happening, you want to replace it a little bit more frequently, and also use a softer toothbrush with a softer pressure as well. But otherwise, every month to 3 months, just kind of as you see fit. You definitely don't want to use the same one for a whole year. You get really sick, you can replace it too. So, all right. Did you have any further questions for me?
Nope.
All right, let's continue with the appointment.